Is it crazy to look for answers in the gut to help a child with autism or someone who's on the autism spectrum? And does your child's clinician steer you away from this topic? I find that a lot of health professionals stay away from conversations about the gut health and supplements because it is still considered controversial and emerging. And I'll be honest, this is an emerging field and I believe in keeping you well informed. So this video is all about helping you understand how the mind and gut relate to each other. What exactly is their language, so to speak, and how we can hope to find some solutions in our diet and nutrition to help children with autism. Hi everyone, I'm Dr. Eileen Shi, a board-certified pediatrician. I work holistically with parents who want a child-centered approach to solve their children's health issues. So if that sounds like you, make sure to subscribe to the channel for more content just like this. Autism spectrum disorder, or ASD, is a complex neurodevelopmental condition that has two key characteristics. Number one, there's a persistent difficulty in social interactions and communication. And two, having a restricted or repetitive pattern of behavior. Now, autism isn't exactly a new diagnosis or phenomenon. It was first studied and described in publications by a Swiss psychiatrist in the early 1900s. Then, in the 1940s, the first modern studies of autism were done, therefore narrowing down the symptoms of people with autism and putting autism on the map of neurodevelopmental disorders for the first time. Over the years, we have become more aware of the prevalence of this condition that has been overlooked for so long and maybe even miscategorized. And as a pediatrician, I treated and interacted with many patients who fall under the autism spectrum. And many families, like you, voice their concern that their child's repetitive behavior, limited speech could be a sign that there is more to it than just developmental delay. And I think while children with autism can present differently with difficulty in social communication and interactions, they also have many unique gifts that allow them to see the world differently, from their attention to detail to their ability to pick up complex mathematical concepts. The question I get asked the most as a pediatrician about autism is, what is the next step? And what are some ways that I can help my child thrive with autism spectrum disorder? While we don't fully know every mechanism of how autism takes form in a person, we do have more awareness of how the mind is deeply connected to the gut and how children with ASD are more prone to gastrointestinal problems and how treating these intestinal symptoms and conditions can help improve social behavior. And in making this video, I want to help you understand, especially if you have a child with autistic-like symptoms or know someone in the family with ASD, the core connection between a child's diet and his or her social behavior, brain regulations, and possibly symptomology of autism spectrum disorder. It is worth noting, aside from the gut, causes of autism include genetics, which predisposes a person to having ASD. We know, for example, siblings born in families with ASD have a 50% greater risk of autism and higher rates of autism spectrum disorder in their children. And there are also other factors that play a role, like exposures to environmental toxins, pharmaceutical drugs, autoimmune disorders, microbial infections or viral infections, and diet during the prenatal and postnatal period, which can all contribute to autism spectrum disorder. Now, what does the gut have to do with the mind? Our brain communicates with our gut in many ways, and you may have heard of the central nervous system, which involves the brain and the spinal cord. And then there is the enteric nervous system, which is located in the gut, specifically in the cells that line the gut, the smooth muscles that propel gut motility, and the glands that feed signals into the gut. So from a bird's eye view, the brain and the gut interact with each other through neuronal and hormonal interactions. For example, when you're hungry, your gut sends signals to the brain that you're feeling hungry, which then makes you aware that it's time to eat. And conversely, the brain talks to the gut as well. For example, when you're frightened, the brain tells your intestines to pause its functions and allow your body the chance to focus on fight or flight. How exactly does your gut send signals to the brain? Well, it turns out the intestines are home to billions of microbes or bacteria, otherwise affectionately called the microbiome, that influence the brain. The microbiome consists of many different strains of bacteria. Some are beneficial to our health by their ability to decrease inflammation and pain, and some are more problematic to our health because they tend to increase inflammation and create more pain and negative symptoms that we experience, like bloating, constipation, and diarrhea. When there are high levels of problematic microbial strains, these active bacteria create toxic byproducts in the form of short-chain fatty acids and signaling molecules, which can increase neural signaling to the brain and increase production of hormones and inflammatory markers that cause unwanted effects in the body and the GI tract, like increase in mucus secretion, permeability, and GI motility. Of note, children with ASD have very different profiles and composition of microbiome compared to children without ASD. Studies have compared fecal matter in children with and without ASD and found that children with ASD tend to have alterations in their microbiome with much more problematic probiotic strains and fewer beneficial strains. And studies done on mouse models have looked at how by changing the microbiome in mice, it leads to changes in social behavior and repetitive behavior in mice. So what is surprising is that mice with normal behavior, when injected with problematic microbial strains, started to show more abnormal social behaviors like social avoidance, lack of interest in social engagements, and more repetitive movements. And conversely, in these mice, their social behavior improved when researchers added beneficial microbial strains to their gut. This finding is pretty exciting because it then begs the question, if by adding beneficial microbial strains can improve mice behavior, maybe changing the microbiome in our gut could help improve the symptoms of ASD in people and children who are affected. And by the way, if you found this information helpful, please give it a like and subscribe to the channel so that you will be notified of future content just like this. Now, you may say, sure, this sounds nice in theory, but does it pan out in real life? In other words, does probiotic supplementation make a difference in children with ASD in terms of their symptoms? Well, many studies have been done in hopes of answering this exact question. So let's go over some findings. A study looked at taking oral probiotics can in fact change the composition of the microbiome in children with ASD, from one that is unbalanced with many problematic microbial strains to one that is more balanced with diverse and plentiful beneficial strains. After 4 months of daily oral supplementation with 3 beneficial microbial strains in children with ASD, the researchers noted that there were reduced amounts of problematic strains and lower serum levels of inflammatory markers known as TNF-alpha, and also reduction in GI discomfort in those children. There's another case study that looked at a 12-year-old boy with ASD. After 4 weeks of daily supplementation of beneficial strains, he showed a reduction in autistic core symptoms and improved GI discomfort. What about probiotics for moms prenatally and postnatally? Researchers looked at daily supplementation of a single beneficial microbial strain for pregnant mothers 4 weeks prior to delivery through the first 6 months after delivery, and compared to the placebo group, where nothing is actually done, there wasn't a reduced risk of development of neuropsychiatric disorders in their offsprings. What these studies show is that diet and probiotic supplementation have therapeutic potential in changing the milieu of the gut, which in turn can lead to improvement in some of the symptoms of ASD. But I'll be honest, there is still so much we have to learn to better understand how diet and probiotics can help children with ASD. So looking into the gut for treatment will play a part in a grand scheme of treating and helping kids with autism. And because autism shows up in different ways and have different underlying causes, some kids may benefit more than others from diet and probiotic supplementation. What we do know for sure is that a, so to speak, bad diet or a bad gut microbiome don't singularly cause or lead to autism spectrum disorder, but optimizing these areas does correlate with improvement of some ASD symptoms. And perhaps probiotic supplementation can be targeted therapy for a subpopulation of children with ASD. There are still limitations to these studies, even the ones that we talked about in terms of how reproducible the results are in the general population. Some studies are done in small study groups, which means that the reliability and the reproducibility of the test are not always guaranteed. But nevertheless, I think this is an exciting area to explore further and to look out for new research and insights on how we can turn to the gut for a way to channel a healthier balance to support the brain development and social behavior. In our Las Vegas-based practice, we work with families one-on-one, offering concierge individualized care to each patient holistically, minimizing unnecessary pharmaceuticals and treating the root cause. We also work one-on-one with families with children who may be on the autism spectrum, from assessment to diagnosis of ASD, complete with a curated nutrition and probiotic roadmap that is tailored to your child's assessment and needs. To learn more about how you can work with us, give us a call to chat. Thank you all for watching. See you next time as we navigate the world of holistic pediatric medicine.